Good day everyone, I'm student nurse Kristel, and so for today's video, we are going to do the immediate care of the newborn. The first thing that we need to do is to prepare all the instruments, equipments, and materials that we need before the delivery of the newborn. We have 2 pairs of blanket, 3 pairs of sterile gloves, improvised cord set, the improvised eye ointment, vitamin K, hepatitis B vaccine and BCG, and the improvised bonnet. Before doing all the procedures, don't forget to wash our hands using the clean water and soap. And assuming that I already washed my hands, we can now sanitize it using alcohol. And then by doing this, we can save time or effort and provide easy access to all needed instruments, equipments, and materials. Don't forget also to double glove our hands just before the delivery of the baby. Double gloving prevents possible spread of microorganisms that can cause infection to both mother and newborn, as the nurses to our co-nurses and doctors. So we have double gloving now. For the immediate and thorough drying, call out the time of birth of the baby, saying the gender and the time of birth because it aids in proper documentation. So mother, one last time. 1, 2, 3, push. Okay, one more time. 1, 2, 3, push. Okay, very good mother. Time of birth, baby girl at 7:10 a.m. Okay, and then we can now get the first clean linen to clean and thoroughly dry the baby or the newborn. Okay, we can now wipe the eyes, the face of the baby, and then the front and back, and then the head, of course, don't forget, and then the arms and feet. And then do it for at least 30 seconds. Okay? The rationale for doing this, the thoroughly drying, is to provide warmth to the newborn and prevent the hypothermia and stimulate the newborn's breathing. Take note also that do not wipe off the vernix casosa and do not wash or bath the baby for the first 6 hours of his or her life because it provides natural protective cover for the baby and prevents the hypothermia and infection. We can now remove the wet cloth to prevent the hypothermia and infection to the newborn. Okay? And then while doing the drying a while ago, we can now also perform the rapid assessment of newborn's breathing. Okay? It can establish the baseline of data, helpful in planning interventions and decision making. Take note also if the baby is crying and breathing normally. Avoid any manipulation such as routine suctioning to prevent any trauma or introducing infection. For the newborn immediate assessment, perform and interpret the APGAR scoring correctly, and it is done immediately after the delivery of the baby and after 5 minutes. This assessment is simultaneously done with the other steps. For the heart rate, I give the baby or the newborn the score of 2 because she has more than 100 beats per minute. And then for the respiratory, I give her the score of 2 also because she has a good vigorous cry. And then for the muscle tone, I give her the score of 2 also because she has a good flexion and active motion. And then for the reflex irritability, I give her the score of 2 also because she can respond promptly with a cry and active movement like she is sneezing. And lastly, for the skin color, I give her the score of 1 because she has a normal body skin but her extremities is color blue, which we can indicate to acrocyanosis. Okay? And then for the total score, we got the score of 9, and then the intervention for this is good and there is no sign of immediate distress, needs only admission care and no special treatment. For the skin-to-skin contact, first place the newborn in a prone position to the mother's abdomen or between her breasts. Okay? And then cover the baby's back using this clean linen. Okay? And then we can now put the bonnet to her head. Okay? And then this keeps the baby warm and prevent the hypothermia, infection, and hypoglycemia and initiate the breastfeeding. And then now we can place the identification band, this on the ankle for the correct identification of the newborn. We can now do the properly timed cord clamping. The first thing that we need to do is to remove the first set of gloves immediately prior to the cord clamping. Okay? Because it removes soaked gloves while still keeping a sterile technique prior to the cord clamping. Okay? And then clamp and cut the cord after the cord pulsation have stopped. Okay, it is typically at 1 to 3 minutes. We need to clamp the cord at 2 cm first. Okay. This is the 2 cm here. And then another 5 cm from the base of newborn's umbilicus. And then cut between after clamping them. Cut between the cord clamps with the sterile instrument. Okay, here. So here. And then observe for oozing blood. Check for the presence of 2 arteries and 1 vein, also known as the AVA or the AVA. And then the appropriate timing of cutting is important in preventing the newborn's brain for bursting a blood vessels and bleeding. Also, it may help increase the blood volume and birth iron stores of the baby. And then proper cord care must also be observed to prevent entry of infection through the umbilicus of the newborn. For the non-separation of newborn from mother from early initiation of breastfeeding, the first thing that we need to do is to leave the baby or the newborn on a mother's chest or abdomen in a skin-to-skin contact like this. Because it promotes the bonding between the mother and the newborn, it also increases the success of breastfeeding or the colostrum feeding. It allows also the colonization with normal flora and protects the newborn from hypoglycemia. We can now observe the newborn's feeding cues. Okay, the feeding cues is all normal. And then we can now take note that we need to give counsel about positioning and attachment. When the baby is ready, advise the mother to ensure the newborn's neck is not flexed or twisted like this. Okay? And then ensure the newborn is facing the breast with the newborn's nose is opposite from her mother's nipple and chin touching the breast. Hold the newborn's body close to her body, to her mother's body. And then support the newborn's whole body, not just the neck and the shoulders. Wait until the newborn's mouth is widely opened and then move her newborn or the newborn onto her breast or the mother's breast and then aiming the infant's lower lip well below her nipple. Look for signs of good attachment and suckling, okay? And then mouth wide open. lower lip turned outwards, and then baby's chin touching the breast of her mother, and then suckling is slow, deep with some pauses, and then for the rationale of feeding cues is to provide opportunity to instruct or to counsel the mother on positioning and attachment. Further aid also in proper documentation. Perform now the Crid's prophylaxis. Administer the erythromycin or tetracycline ointment to the both eyes after the baby or the newborn has located to the mother's breast. And then assuming that this is my eye ointment, and then take note also that do not wash away the eye antimicrobial to prevent the ophthalmia neonatorium or gonorrheal conjunctivitis. And then take note when you are applying the eye ointment, do not put directly to the newborn's eye. It is just, you will put this inner to outer like this. Okay, and then the other eye, inner to outer. Okay, that's it. Next, perform the physical assessment. The first thing that we need to do is to weigh the baby as per hospital policy. Assuming that this is my weighing scale and this is just an improvised, and then remove the cover of the baby for the accurate weight. And then put it here. Okay. And then this is now the weight of the baby. And then get it again the baby and then cover it with the body part that is not belong to the procedure, okay? To prevent the hypothermia. Okay. And then, start the procedure with the cephalocaudal technique. Take the head circumference with this measuring tape. Okay. Okay, it is 27 centimeter, but the normal value for the head circumference is 34 to 35 centimeter. And then next, take the chest circumference. It should be aligned to the newborn's nipple. Okay. Put it down, and then take it. Okay, it is 30 centimeter, and then the normal value for this is 31 to 33 centimeter. Next, take the abdominal circumference. It should be slightly above the umbilical area. Okay, put it down again, here. Okay, it is 32 centimeter. But the normal value for this is 31 to 33 centimeter, also like the chest. Lastly, take the newborn's length and then place the newborn into lateral position. It's either right or left, okay? It's 38 centimeter, okay? The normal value for this is 50 centimeter. The anthropometric measure can establishes the baseline data, noting normal and abnormal findings, of course. And then next, dress the upper body of the newborn to prevent the hypothermia. Okay. Assuming that I already dressed up the baby in the upper part of her body. Okay. And then check the anal patency now of the newborn to verify the baby's anus is not imperforated. Okay. Give now the vitamin K prophylaxis, hepatitis B vaccine, and BCG at birth. Check the name and the expiration date first of the specific medicine or the medication before aspirating. Aspirate the correct dose skillfully to determine if it is a correct vaccine, okay? Expired vaccine or the diluent should never be used, okay? And then before injecting the specific medication, we should disinfect the desired site before injecting to prevent the infection. Okay? And then the first thing that we need to do is to inject the vitamin K prophylaxis via IM to left vastus lateralis to prevent the bleeding. Get some cotton ball and then the alcohol. And then disinfect the left vastus lateralis. Then discard. Get the syringe and the vitamin K. Then aspirate the correct dose. Okay. And then get the cotton ball with micropore. And then we can now inject to the patient. Okay. Okay. Next, we can inject the hepatitis B vaccine via IM also on the right vastus lateralis again to prevent the hepatitis B infection. Okay, and then get some cotton ball again and then disinfect the right vastus lateralis of the newborn. Okay, discard and then get another syringe. And then get the hepatitis B vaccine here. And then aspirate the correct dose. Okay. And then get another cotton with micropore and then inject now. Okay. And lastly, inject the BCG via interdermally on the right deltoid region of the arm of the newborn to prevent the serious forms of tuberculosis or the TB. Okay, and then get again another set of cotton ball and put some alcohol, disinfect, okay, and then discard, and then get another set of syringe, and then get the BCG, and then the BCG. And then we can now aspirate the correct dose of BCG. Okay, and then inject it via intradermal. Okay. Okay, that's it. And then scoop the cup of the syringe to prevent the accidents or the unnecessary dangerous things. Dress now the lower body of the newborn and then place the diaper or the pajama and wrap the baby using the swaddling technique to prevent the hypothermia. Okay. Okay. The saddle. Okay. Tie it and then roll it in the back. And then cross it on. Okay, that's it. And lastly, don't forget to record all the pertinent observation and nursing care done. Document all the measurements and document also if the infant voids or passes meconium. Report any signs of deviation and abnormality to the pediatrician. This will provide complete and proper documentation to all pertinent data. So, thank you!